So the space for patients with systemic light chain amyloidosis has really changed with the advent of the Andromeda trial, where we now have Dara-based induction therapy. And I would say for newly diagnosed patients, the standard of care with the FDA approval of Dara-CyBorD is really Dara-CyBorD. However, the question then remains, who do we take to an autologous stem cell transplant? And I think that's really where the unmet need is in terms of the questions that we have for this population of patients. Now, if you look at the response rates for Dara-CyBorD, patients who get into a VGPR or better, it's around 80%, which is absolutely wonderful. But, and clearly with those that don't have a adequate hematologic response, then I think it's very clear they really need to be taken to another form of therapy. Perhaps stem cell transplant would probably be the most preferred. But what happens to a patient who achieves a VGPR or a CR with this regimen? Should they be transplanted or not? And that, I think, is the question that needs to be answered. I know that there are cooperative groups that are actually studying this issue, and they're putting together a transplant study in systemic AL. So I am eagerly anticipating that protocol, because I think that is going to really solve a really important question in the treatment of these patients. And now, this conversation would be incomplete without talking about other treatments for systemic AL amyloidosis. So for someone who has an adequate hematologic response to Dara-CyBorD, that 20% of patients or so, what happens to those patients? And and what if they're not transplant eligible? What should we do with those patients? And I think there are a lot of exciting clinical trials using agents that have been approved in the myeloma realm, and trying to see if it's safe and efficacious in patients with amyloidosis. Some of those agents include Belantamab mafodotin. That's a very exciting agent that has demonstrated safety and efficacy in myeloma. There are several trials, some in the US as well as in Europe, looking at that agent. There are also venetoclax as well for patients who have translocation 11-14. So I would say in the management for systemic AL, I think that is generally the management. Trials that are investigating newer agents, and the questions that are really important include stem cell transplant. There are a lot of other questions as well. For example, what about how do we pick this up earlier so that patients are not at advanced stages of disease when they come to see us? And I think that's where some of the imaging trials are going to be very important. There's a company named Atralis, and they have a pan-amyloid detection agent that has been in trials, and we're eagerly anticipating what further trials they would do with that agent.